Thank you, and welcome, Sultana.
Yeah. Hello, everybody. I'm going to switch my camera on briefly, and then to help bandwidth, I will switch it off. But just so you know, I'm not a robot. My name is Sultana Pasha. I will be carrying out this session with you today around environmental sustainability, one of the new quality statements that CQC is introducing in 2025. It has already been released, however, they'll be inspecting you from 2025 January on this quality statement. A little bit about my background. I am an ex-CQC inspector and currently working as a consultant and a quality lead for a care homes organisation. Under my belt so far, I have just over 14 services who I've supported to achieve outstanding. The most recent one, environmental sustainability, was covered due to the fact that my organisation was so prepared for the new quality statement. The inspector actually agreed to include that within the inspection, and that was an outstanding inspection as well. The quote from her was that it was one of the only services that she'd come across that were fully prepared for environmental sustainability under the CQC regulations. Okay. I will switch the camera off now so that you don't get any disturbances. Okay, so though many of you would have done a little bit of research and studying around the quality statements. So at the moment, CQC have released 34 quality statements. Um, those quality statements, and I know there is a lot of questions going out at the moment, and there is a review. So far, the noise is that the quality statements will remain. The way in which that they are inspected or assessed will change. So, for example, the scoring mechanism is likely to be removed and will go back to the inspector's judgments, which I personally think is a lot better way of reviewing the quality statements. If you've had a chance to look at the quality statements, I hope that you would agree that um, they do help providers to fully understand what the expectations are, and it does allow you to focus your efforts on specific areas, whereas previously it wasn't as clear. And obviously, environmental sustainability and sustainable development is an area that a lot of providers at the moment are needing some support with, because obviously we haven't been asked before what we're doing for the environment and how we are building locations, care homes that are sustainable for the future as well. So it does really require us to start thinking outside the box. Okay. So we all are, well, those of you who have been looking at the new quality statements are aware that we statements have been launched by CQC, and we statements are the statement from the provider as to what they're going to do. So the we statement in relation to environmental sustainability states that we as providers fully understand the negative impact of our activities on the environment, and we are striving to make a positive contribution to reducing it and support people to do the same. So it's us as providers looking inwardly at what we're doing and what impact that's having on the environment, as well as supporting people around us, so educating people to enable them to be more sustainable as well. So it's putting a lot of responsibility on us as providers to start educating, coaching our teams, our residents, our clients, our families, our local community on the impact that we as a population are having on our planet. So what does the quality statement mean? What basically what it's saying is that as providers, we need to recognize that climate change has a significant threat on the health of the people that we're supporting, our service users, our staff, and our wider population. And we are accountable for that as well. So we have to understand and we have to showcase that to CQC that we are responsible providers and we fully understand the impact that we're having on on the community around us, on the earth, on the planet. We have a responsibility in which to empower our staff so they understand how we can be a more sustainable healthcare system as a whole, and how we can reduce the impact on the environment as a healthcare sector. So we have to evidence that to CQC when they come in. We also have to have shared goals on how we're going to prevent as well. So we have to have those strategies in place. We have to understand how are we going to reduce certain things. So an example here is if we're looking at low carbon care, for example, how is that going to reduce the air pollution and lead to significant reduction in coronary heart disease, stroke, and lung cancer? So there's the impact. When we talk about outstanding and when we're talking about the outcomes for our client, sustainability falls within the same area. So if we are a more sustainable organization, then what impact? It's not just going to have an impact on our clients, it's going to have an impact on the health of the wider community and reduce things such as stroke, lung cancer, coronary heart disease as well. We also have to have plans in place and action plans to say, how are we going to become low carbon organizations? Are we going to look at our efficiencies? Are we going to look at renewable energy and how that energy is going to be used more effectively in order to reduce our carbon footprint? I remember when I was doing this project with my care home, one of the key things, and those of you who have got care homes will know that the lights are always on because residents shouldn't be walking into a dark room. However, we had to change the way we think because we were now thinking, well, actually, is that efficient? Are we having an impact on the environment? So it was about having conversations with our clients and our residents to say, is it okay if we, leave the cinema off, the lights off in the cinema or the lights off in the dining room when it's not in use, because actually we want to be an organization that is sustainable. So leaving lights on for a long period of time is going to have an impact on the environment. So we had to change the way in which we were looking at things and also bring our clients and our residents and our staff on a journey with us as well to say, actually, we need to change the way we've been doing things. And yet take active steps towards ensuring net zero as well. So it's not just making a promise and saying we're going to do something. How are we going to do it? And we are actually doing so, measuring as well. So CQC are not saying just make a promise and let's go with it. What they're saying is you make a promise, you then carry out an analysis and you say where you are at the start of your project, and then you could deliver your project, and maybe 12 months later you then showcase actually what impact has that had. So it might be that you make a promise around reducing the use of electricity. Okay, so you at the start of your project would keep a record of how much energy usage you have, and then after implementing the project, you would then go ahead and do another review and see what percentage reduction of energy have you had. So that's the kind of thing that they expect from you during this, when you're evidencing this quality statement. So what does the quality statement cover? So specifically, and this is taking from the CQC regulations and the CQC website, what the quality statements is saying is you need to educate your staff. Your staff need to have awareness and they need to have an understanding of what their role is when it comes to this quality statement and the impact that they're having. So their actions have on you as an organization and how sustainable you are. So, for example, your domestic team, do they understand that the products that they are using to clean the home, what impact does that have on the environment? What impact does that have on the health of the people within the home? So it's thinking around spillages. So when I was doing one of my projects, we had to go as far as look at the drains outside and risk assess that if there was a spillage and if a truck came, for example, and there was a spillage in relation to diesel, and that went down into the drains, that would have an environmental impact. So our risk assessments had to be tweaked to actually take those kind of risks into effect and also educate the team. So when the kitchen team were taking a delivery, for them to understand, well, there's actually a diesel spill kit now available. So should there be a situation where there's a diesel spillage, which is 1 in a million chance of it happening, they knew exactly what to do, and that was to protect the drains because we didn't want to have an environmental situation happen in the home. With our domestic team looking at the products that they were using, and in the past it's been about safety for clients, but now it's a safety for the environment. So, can we look at cleaning products which are possibly vegan cleaning products and have a lesser impact on the environment? So, it's educating the staff about the awareness of the impact that their everyday work has, speaking to nurses and saying, actually, when you've got a situation and maybe the GP is over prescribing a medication, we need to have those conversations around the medication and the oversubscription, because what does that result in? That results in medication waste. So looking at waste as well and saying, well, it's not just about what goes in the bin or the general bin, it's looking at the clinical waste, it's looking at the medication waste. So staff awareness is a huge thing that this quality statement covers. And there's a lot of training that needs to be done with your team, because to implement environmental sustainability in your organization, the people that are going to lead it are going to be your team. The other thing it's looking at is carbon reduction. So, looking at your transport links, the medication, the supply chain. So, we have to start thinking as an organization that, okay, so if we are ordering items from Amazon, for example, um, do we need to place, or have Amazon trucks coming every day? Or can we wait and place one order so we only have one delivery within a week instead of multiple deliveries? So it's accountability on the side of the provider for them to say, right, I'm going to reduce my carbon footprint by actually thinking about travel, transport. I'm going to look at my supply chain. So if I'm ordering items from a company which is maybe 100 miles away, however, there is a local provider who is 3 miles away. Yes, there might be a slight price difference, but if I look at it as an environmental impact, that truck coming from 100 miles away versus the truck coming from 3 miles away, the impact that my actions are having on the environment is lower. And that is what CQC want to see from you from this quality statement, is that you're having those kind of ethical considerations as a provider to think outside the box. Speaking to your teams and looking at training, for example, does training have to be face to face, or can it be done remotely? What is the output? What is the benefit of having everybody driving, everybody getting into cars, everybody creating those emissions and driving to one central location to have a meeting, when actually that could have been done without that, and create having that carbon footprint? So it's consideration on things like that. Sometimes it can't be helped, but it's being awareness. It's the awareness that you need to showcase within this quality statement. Also, health promotions and prevention. So, how are you promoting the health of people around you? How are you preventing ill health as well? So, looking at the way in which you're doing things. So, that's things like encouraging your team to be more healthy. So, it might be that you introduce healthy menu options within your services. You encourage your team to have vegan Mondays or meat-free Mondays and things like that. So really encouraging that way of thinking in your services, even if you've got, in care homes, yes, you can promote them, but even when you're in a domiciliary service, is promoting health within your team. So encouraging them to exercise, mental health support, physical support. So if you've got team members who want to go on, morning runs and things like that, promoting that, encouraging that healthy lifestyle within your team, and also for your clients as well to find ways in which to support them. Um, excuse me. Um, those of you who have got care homes, for example, your estates and facilities, but also for domiciliary services, which you've got offices as well. And it's looking at how you can save and be more efficient. So, like I said before, looking at the usage of lighting, and you replace lights to more efficient lighting? Do you have to have all sockets switched off? So getting into the habit of switching sockets off when the items are not in use. Looking at paper, the use of paper. Why do we need to print things off? Recycling. So a lot of organizations, and I found within my homes, my team we're all recycling at home. Everybody recycles at home. I've got, I don't know, 5 bins sitting outside, and I have to figure out what goes in which. But when I went into the office, suddenly all of those recycling things went out the window. There was one general bin and everything went in there. But actually, we then introduced it, and that team were really happy because this it's what they're used to doing at home. They just couldn't understand why it wasn't happening at work. So if you've got an office, for example, thinking about different types of the waste that you're producing and the recycling of it. So thinking about your paper waste, your toners, your cardboards. Food waste, thinking about, are we wasting a lot of food? We shouldn't be doing that, and we should be identifying how we can reduce that, encouraging the team to switch things off in the office. So important. Uh, in care homes, so many times you might go into a care home and the central heating is on and the windows are open, and you're thinking, why are we doing this? So thinking about the heating mechanisms. Why have we got, if we've got gas, are we moving across to electric? Um, if you're building new care homes, thinking about the future is moving away from gas. So, are you setting up your homes to be more efficient through the use of electric rather than gas? Are you swapping out old lighting for LED lighting? Are you, encouraging? So, after meal times, for example, are you looking at the food waste? Analyzing how much food waste is coming through, and encouraging your chefs and your cooks to reduce the amount of food that's being prepared in order to be more sustainable. Or you're looking at that waste and you're looking at ways, okay, so if we have leftover food, what can we do with it? Well, actually, we could offer it for our team members to have for lunch. So straight after the main meals, the team are offered lunch as well. So we're not throwing that food away. We're remaining sustainable in that when we're thinking about where we're ordering that food from. So it's that field to fork situation. Go to local providers for that as well. So really looking internally at our estates and our facilities. Also, the type of organizations that we're linking with is very important. So when you have contractors coming in, CQC's expectation is that you're working with similar organizations that are on the same net zero pathway as you. So when you are taking on new contracts, you should also be considering and asking the questions. So, what is your ESG policy? What is your net zero goal? What are your net zero goals for the future? So you know that you're aligned with your suppliers, and they're going to be working with you. I remember I had a supplier who, when we had to order paper every now and then. So whenever we ordered a certain number of reams of paper, their policy was that they would plant a tree. So we were able to say that actually from ordering that paper, we're ordering recycling paper, we're ordering it from a local provider, but on top of which, that provider, every time we order X amount, they then plant a tree from on our behalf. So at the end of the year, they would send us a report to say, you ordered X amount of paper from us this year. Out of that X amount of paper, we have planted 20 trees. And then that was us offsetting our environmental impact as well. Yes, I have a hand up, Elizabeth.
No, it was me just
Was
reacting
it?
to that,
No.
Sultana. I do
Oh,
like the
okay.
plant a tree idea. So yeah,
Yes.
yeah,
So we
absolutely.
should really definitely have those conversations with our suppliers and say, right, this is our journey that we're going on. Are you on a similar journey? Because there's so many organizations that are doing that, but they don't always share that journey with us. So bring it up in your agenda when you are looking at those suppliers, definitely. Um, and how efficient the efficiency of your service as well. So they don't just want to know that you're being, you're being open to environmentally friendly and you're being net zero, but actually you should be the output is that is efficiencies for you as an organization. So there will be savings, there will be cost savings for you. So because if you are reducing the usage of paper, for example, then you're going to be spending less on paper. If you are switching lights and switches and computers and laptops off in the evening, then you will save on your electric bill. If you're encouraging people to use less water, so when when, for example, when residents are having a shower, not a shower, brushing their teeth, is to say to the team, encourage the residents not to leave the tap running because then that again has an impact. It's efficiency when it comes to the water users, and it saves us money as well. The food, like I said before, if we're looking at the output and the waste of the food, and then we're looking at the way we're ordering, we should be saving money as well. So it's a win-win in both situations. You're looking at the environment is winning, but you as an organization are reducing your costs as well, and you'll also have engagement from your team. So what you need to consider, I've gone into this a little bit, but as an organization, you should consider your net zero promises. So you need to make some promises to yourselves. You need to make some promises which are visible. So it's not you sit in a room quietly and make a promise. You need to advertise it. You need to share it with your team, with your clients, with your local authorities. Let people know what those promises are. If you look at the NHS, for example, you'll see that they have made some very big promises. It's on their website. They are holding themselves to account and they are reporting on their net zero promises. But make sure that you make promises which are achievable as well. It's all great for you to say, well, we're going to be net zero until 20, by December 2025. That's not that far away. And maybe what you would say is, we are going to reduce X percentage by then. We're going to. Your net zero journey doesn't need to be an instant journey. It's a journey that you're committed to, but you need to make it realistic as well for your organization and what your budgetary requirements are as well. I had a situation when I was supporting one of my services, I wasn't given a budget. So I had to implement an ESG strategy without a budget because it was all about efficiencies. So it's not about putting money in to this, it's about drawing efficiencies out because a lot of things are just common sense and things that we maybe do at home, but we're just not doing in our place of work. We should have green plans in place. So thinking about the future, how we're going to support. It might be, plans in our local community. It might be plans in relation to our next office location, it might be plans, our next care home. We should have those plans in place and be working towards them as well. Looking at our own infrastructure around transportation, if any of your companies have cars, for example, looking at do we buy electric cars or do we buy hybrid cars? Do we encourage our team when they're swapping out their cars to go for electric cars? Do we provide them with an incentive? Looking at having charging points available. So in all of my services, we put in charging points, and that was to encourage more and more people to go electric. So come to work, charge. So that was a way for us to really support them. But we also needed efficiencies in that one. So we can't have everybody charging in the office because then our bill would be extortionate. But what we did do is limit it to half an hour charging to support. Okay, you can charge, but it's half an hour charging. So you have to offset things as well. Otherwise, if everyone turns up to charge their big cars, number one, no one's going to be able to charge because cars are going to be using it. But the other thing is we're going to end up with a huge electric bill. So it's looking at it in a sensible way as well. And like I said before, looking at the transportation, so encouraging maybe cycle to work schemes, encourage people to use public transport and some of these things are already in place. So you wouldn't need to change anything, but you promote it as part of your sustainability strategy. I touched on medication before. Yes, Elizabeth.
I was just going to add on the electric vehicle, Sultana. There's a provider in our area, which it's quite rural, and they inquired. They had a pool of vehicles, and they inquired because their leases were coming up and wanted to move over to electric vehicles. But unfortunately, because of the rurality of where we are, their electricity supplier could not put the grid could not cope with any additional supply to their location. So they were scuppered a little bit in trying to move this forward. So I think we have to bear in mind,
And
geographically
that
and the infrastructure being in place for us to be able to support it.
Yes, and that's where your green plans come into play. So, as you may put in a plan that you want to be, so that provider could showcase to CQC that actually we had a plan that we wanted to go fully electric. However, our electric provider, our grid, at the moment is not set up in that way. So we're going to keep it on our plan. It's part of our green plan. We've tried it now in 2024. We want it, but the infrastructure won't allow it. So we've now moved that along to we will review it again in a couple of years' time and see if the grid have caught up with us yet. So it's about showing them that yes, you may not always be able to implement the things that you want, but it's about knowing that that you want to do it, but there might be an external factor that's preventing you from doing it. So that's absolutely fine. And that's what CQC is saying, that you need to be aware of the impact that you're having and what you need to do to make that change. But yes, there may be some blockers that come in the way, which is outside of your control and is nothing that you can do, but at least you're working towards it. Okay. Um, with medication again, so medication is a difficult one. So we want to save on the on medication. We want to make sure that it's not being wasted unnecessarily. However, the type of clients that we work with, medication can change weekly, and then you end up with medication that is having to be disposed of. But again, it's just showing that you're continuously having those conversations with your pharmacy. You're continuously having those engagement conversations with the GP to try and find solutions. Sometimes there won't be a solution, but what CQC are wanting to see is that you're not just accepting and you've got hundreds of meds being disposed of every month and nothing changes. It's about if there's a sudden increase in the number of medications being disposed of, you're then having those conversations or you're able to recognize and evidence that you've had that engagement and you've tried. As long as you've tried, that's what they're looking at. It's not, it's taking accountability of your part. The next part is the GPs. The GPs need to think about when they're doing repeat prescriptions. Okay, if they've done a repeat prescription, and we know so many times it's just they press a button and a whole load of medication just gets sent through. But actually, if that person has been refusing that medication regularly, what CQC want to see is, have you done a review on that medication with the GP to say, well, actually, they're not using this medication anymore. You continue to send the same amount of medication, but their situation has changed. And we actually should be in a situation, we should be reviewing this, and we don't want to be disposing of this all the time. So it's looking at that way, the ways, and also the type of products you're purchasing as well, medication wise. So we did something like you know and I know it's hard because you have your medication pots. So changing from plastic meds pots to paper medication pots, which were recyclable. So thinking about it that way, that we need, because they need to be single use as well. Medication pots should be single use. And if you're washing things, you are washing things down the drain. The impact that that's having on the on the sewage system and the water system, these all make a difference. Looking at medications when you're washing things, is that's little residue going out. And I have so many people that say to me, "Oh, Sultana, can I wash this pot?" No, you can't wash it, because even if there's a little bit of residue, it's going to go down the drain, and that's going to have an impact on the environment. So you have to dispose of it safely. It has to go in your clinical waste. Understanding the importance of medication and the way in which it's disposed of is so important. So it's not just looking at safe medication, it's looking at safe disposal environmentally as well. So looking at the environmental impact that you have on people. So yeah, sometimes it results in um, you, you end up with more things. So we moved from metal spoons to plastic spoons, single use. But then you could say, well, actually, you're using more plastic. But then we had to offset that with something else. So it's saying that, yes, one thing we've had to do because it's a safety thing. And we don't want, and actually, what we're saying is, yes, we're using plastic spoons, but we're going to use ones that are recyclable. But they're going to go in the clinical waste, and then that will be dealt with by the clinical waste team. However, the offset of that is we don't want to be washing in the clinical rooms, and we've got things going down the drain that could impact on the water table anyway. So you have to offset and you have to evidence why you're doing things. Oversubscribing, I've already mentioned, and obviously buildings I've already gone into quite a detail as well. So these are all the kinds of things that you have to consider as part of this quality statement. I personally think that as a quality statement, it's a really interesting one, and it's one that a lot of people can get behind as well, especially if they're into recycling. When we're dealing with our clients, especially as our clients are changing, getting younger, you have more and more people where recycling is now a habit. It has become a habit for everybody, and we can really engage that. So when we're talking to people, whereas if you're dealing with somebody who's maybe not in their 90s, and where recycling wasn't really the thing to be doing. However, wastage was also not a good thing, so they can come on board. We had a situation where we looked at the offcuts from the kitchen, and we wanted to become 100%, zero waste within the kitchen. So it was thinking about, what do we do with those onion peels? What do we do with those offcuts? What do we do with the skins of the potatoes and things like that? So we gave the chefs a task to say, right, we want you to become as close to zero with the waste as you can. So what did they do? They ended up making like potato chips out of the potato skins, and they put pepper and salt on it. They didn't tell anybody that this was the offcuts, and it was presented to the team. The team absolutely loved it. They made soup out of the leftovers, and um, everyone loved the food. And then right at the end, they said, "Well, today we were zero wastage in the kitchen because what we did was we prepared the residents' meal, and then everything that was left over, we made soup, we made this, we made this. We've had zero waste in our kitchen today." So it's bringing everybody on board to say, wow, we can do this. We don't need to throw everything, no, throw things in the bin. We should, if you've got fruit that's slightly browning, can we make something out of it? Could it be added? Could we make jam? What can we do? And start thinking outside the way. It's so easy just to throw something in the bin, but we now need to be more, and where we segregate our waste, then that makes it more, you become more accountable, because if you're monitoring those different types of wastes that are going out of your service, then you will ask that question. So, oh, what? We got so much food waste this today. What happened there? What? So much cardboard. What have we been ordering? What's been coming? Have we had a big delivery? And what's happening? Oh, actually, why has the general waste got food in it? Why has it got plastic in it? Why has it got cardboard in it? That should all go in. So monitoring what's going even in our general waste bins as well. So some more steps for you to consider, and I will share this. So this is things that you could implement. So you can upgrade to energy efficient appliances. So replace old HVAC systems, lighting, kitchen appliances. So if you've got care homes where you've got domestic dishwashers on kitchenette units within the services, replace them to the industrial ones. Yes, it is slightly more expensive, but actually you go from a 3 hour wash cycle down to, I believe it's a 5 minute wash cycle. So if you look at the electricity efficiency, the time efficiency, then actually it's a lot more beneficial. So yes, there might be initial cost, but actually long term it will cost you a lot less. The same goes for replacing your lights and your bulbs and going LED rather than having your box standards. Yes, there's an issue, and you don't have to go out and change every light tomorrow. What you do is, as and when a light fails, you then deal with light, or you deal with an area. Insulation, looking at proper insulation around your buildings, cooling needs as well, how you deal with those. So really look at your environment. If you're building new services, or if you're going for refurbishments as well, really ask those questions around how you're going to be more efficient with your energy, so you don't want to be losing energy anywhere. Monitoring your energy use. So implement a system that tracks your energy usage, not just pay your electricity bill every month. Look at how much electricity is being used. Look at how much gas is being used. Monitor the amount of paper usage within yours. Monitor the printing as well. So I implemented a printing review. So it was shocking, because when I ran the report to have a look at who were the regular printers within the organization, it just did not make sense why this department was printing so much. And so I had to then go and have those conversations and say, why are you printing so much? Because everything is electronic. There you are off the scale with printing. And then it was people's habits. They were just in the habit. So instead of for example, printing off 10 sheets or something. Maybe it's a monthly checklist, for example. So instead of printing off that week, they would print off 20 and put them in a folder. Well, hang on a minute. What happens if that is, the document is changed, or there's an update? You end up having to throw all of those documents away and then reprint them again. So we had to really speak to people and change the way that they worked. Adopt sustainable transportation, so promote electric hybrid, carpooling, so share car. If you're going somewhere, share the ride with each other. You all work together, and a lot of companies already do this and encourage walking and cycling. Reduce waste and implement recycling, single-use plastics, minimize the use of those, have recycling programs, compost heaps. A lot of care homes can create compost heaps. You can get your residents involved in that, in the gardening. And make your staff aware, do waste awareness training, do we, in sustainable training with them as well. And yeah, composting is a really good way in which you can really support, especially with that food waste that you can't reuse or you can't put into anything that can go on your compost heap as well. Solar panels, if you are looking at upgrading your homes or doing some refurbishments, it's always worth considering solar panels, depending on whether they will work or not in your if you're in a quite a overcast area, then obviously that's not going to work for you. Um, Consider renewable energy. And switch to suppliers, like I said before, switch to suppliers who are on the same green journey as yourself, and find out where they're getting their energy from as well, because it should be a whole chain of sustainable people working together, because that's going to have the biggest impact. There's no point you going to a provider who is having such an impact on the environment, but you're trying to do your little bit. You need to be working with these people who are working down the same path as you. Source things locally as well, purchase things locally, reduce your carbon footprint. Um, Eco-friendly cleaning systems, I've already mentioned to you, look for non-toxic cleaning, biodegradable, recycling medical supplies where possible. But obviously you need to check that as well, because not everything can be recycled when it comes to medication. Digitalization of records. Now, CQC, funnily enough, have they've gone down this route of asking providers to be efficient and go electronic. I recently had an inspection, and during the inspection, the inspector asked us to print off all of the care plans. To which I walked in the room and I said to her, "Why do you want us to print them off?" She goes, "Oh, I prefer to look at them on paper." To which I then reminded her of the sustainability quality statement and said, "We are a sustainable organization, we are electronic, and therefore we do not print out our care plans." And we did not print off the care plans for her, and we asked her to review it on the system. We were happy to email them as PDFs, but again, what we said to her was, you will not get the full impact of the care plan by having a PDF copy on your screen, because you will not be able to see the alerts, you will not be able to see all the information our team sees. So sometimes you have to be, when you are really working towards sustainability, you stand there and you say, well, actually, you've told me to be a sustainable organization. Why are you not being sustainable? Why are you not following your own guidance on this? And she accepted that. And we got an outstanding. So she didn't take any offense as well. Okay, so that is a very quick run through of the quality statement for environmental sustainability. I've left 10 minutes for Q&As as well. So does anybody have any questions around what I've spoken about? Any ideas that you might have? Fire away.
Can I just kick off, Sultana, just a bit of a comment kind of question as well. For on behalf of smaller, single homes, single provider services where some of the cost impact for them is a consideration. How can they kind of take on board some of the sustainability elements of this new statement within their cost as well? We're in a very challenging time at the moment regarding funding and fees. So I'm just thinking of the smaller single provider, any useful insight for them?
Yeah, so as I said before, I didn't have a budget when I implemented environmental sustainability in my organization. So it was having to think about what we have and how we can tweak it, adjust it. So what services can do? So we for example, we did no mow May. So we didn't mow the lawn in the month of May. Now normally we would say we want our gardens pristine and perfect, but the environmental aspect that we ran with was actually we're not mowing the grass. It's encouraging wildlife into the garden. We've now got little daisies and bluebells and all of these, and we've got bees coming in, we've got butterflies coming in. So that all coming into our garden area actually has a positive impact on the environment, and it encourages that. So that didn't cost us any money. Actually, we saved 1 month of gardening fees on that, but it was our and that's what we showcase to CQC. So it might be these small little things that you
Mm,
do as a provider, and that builds your evidence portfolio around sustainability. Switching lights off,
mm,
doesn't cost any money. Thinking about when appliances are switched on, dishwashers going on, making sure that it's filled properly and it's being cleaned. When staff are washing up, for example, not leaving the tap running. All of these things don't cost any money. It is a change of the way that we think, that we should encourage people to do. Dividing your recycling doesn't cost any money. Instead of throwing everything into the general waste bin, encouraging your team to segregate, um, uh, you know, all items doesn't cost any money.
yeah, thank you. Um, Happy to open it up. Any questions or comments from anybody on the call? Anybody want to be brave?
No?
No?
So everyone's writing down their environmental strategies as we speak and are ready to go. Are there services who are already on this journey who might want to share?
Mm,
No one's
no?
brave enough?
No? No. Well, I hope you found that useful. I mean, it's been very interesting, Sultana, and yeah,
Oh,
I oh, wait
Jane.
a moment, very interesting and helpful. Thank you, Jane.
Oh, thank you,
Um,
Jane.
and I mean, this is the first in a webinar that we're in discussions with Sultana for hosting. We're going to be talking about a second one, aren't we, Sultana, around staff wellness.
Yes.
So, if you're not on hopefully you are on our list because you've all signed up for today. Just keep an eye out for that. We'll circulate some dates when we've finalised. And as I said at the beginning, it is being recorded. I need to actually stop recording.